Hi everyone, this is an anatomy and physiology video for healthcare students. In this video, we'll be talking about homeostasis. Let's start by talking about the term homeostasis. It means standing still. In the human body, this means we are looking to maintain a dynamic equilibrium, a balance, or a stable state. Most of the time, we are looking to maintain the body's preset values within a narrow range. For instance, we might be looking to maintain blood pressure within a narrow range of acceptable values. These are values that are set by the human body, and in many cases, they're maintained by a control center in the brain. But that's not the case for all forms of homeostasis. We're actually going to explore two different kinds of homeostasis: positive feedback mechanisms and negative feedback mechanisms. Most of our human body mechanisms fall into the negative category, but some of them do fall into a positive feedback category. Let's first detail a negative feedback mechanism. In this example, we're going to use the brain or the central nervous system as the control center. The control center is going to be the part of this particular feedback pathway that makes decisions. So this is generic. We're not using an example. We'll do one in just a moment. But in this pathway, we're just following how it would normally be laid out. So a negative feedback process starts with a stimulus that disrupts the maintenance of a balance or a dynamic equilibrium. It puts us outside of our range of values that are acceptable. There is a set of sensory nerves called a sensory pathway that carries that information to the central nervous system. Keep in mind, we're using an example this time that uses the central nervous system, such as brain or spinal cord, as our control center. So the control center makes decisions. The control center says, okay, this value is outside the acceptable range. Here's how we're going to fix it. And it turns on a motor pathway. This is an efferent pathway that travels away from the central nervous system with a message on how to fix the problem. We carry that message to an effector. An effector brings about change or an effect that will help to restore homeostasis and cancel the original stimulus. Keep in mind the word negative implies that we are stopping, canceling, or inhibiting what is happening to put us outside that narrow range. So in the human body, muscles such as smooth muscle or cardiac muscle may be effectors. Glands such as sweat glands may be effectors, and organs. So we're looking at involuntarily controlled parts of our body playing the role of effector. Positive feedback mechanisms do not work to cancel a stimulus. Instead, they work to enhance or increase a stimulus. A few examples here could be, say, oxytocin release by a hypothalamus through the posterior pituitary to encourage uterine contractions in a female who is giving birth. Another example could be platelet plug formation during hemostasis. This is how we form the blood clot that should capture blood cells from escaping, and it's one of the first steps here in helping us to retain blood loss. So we limit the amount of blood that we're losing by a platelet plug formation. The more platelets rush to the site of the injured vessel, and the more they release chemicals to call more platelets, the more likely we are to form that clot. So that's a positive feedback mechanism. The enhancement of more platelets calls for more to come and more to come until we eventually get that clot to form. That's how we think of this as an enhancement kind of process. So let's talk about the roles of effectors in maintaining homeostasis. There's two kinds, negative and positive feedback. Let's work through an example of negative feedback first. With negative feedback, we are looking at, say, body temperature. So if you go outside on a hot summer day, it's 100 degrees outside, you may begin to become overheated. So sensory receptors tell your brain Your brain determines that this is above the normal preset value, and in turn, your brain alerts through a motor pathway your effectors to help reduce the body temperature. So in this example, what are the effectors that cancel the stimulus of being too hot? That would be sweat glands. The sweat glands produce sweat until we reduce our body temperature back to a narrow range of values that is acceptable. So in this example, the effector is going to be sweat glands, which cancel the stimulus of being too hot. Let's talk about positive feedback mechanisms. In this case, the effector's job is to enhance or increase a stimulus. Our goal here is not to maintain a narrow range of values, but rather to enhance a stimulus. So eventually we can achieve homeostasis through enhancement or increasing that stimulus. Let's do some examples. Let me explain a little bit about what's happening, and then you can guess what type of feedback mechanism maintains this particular process. During lactation of breastfeeding, a baby latches on, the baby suckles the mother's breast, and as long as the baby suckles, milk is produced. The suckling is going to enhance or increase production of milk. What type do you think this one is? That's a positive feedback mechanism. What clues should you look for? Well, a couple of things here. You've got a baby suckling. The increased suckling increases the milk production. You could also say it enhances milk production. Those are keywords to listen out for or to look for to help you determine it's a positive feedback mechanism. Let's talk about hunger. So if you're hungry, haven't had something to eat for a while, your stomach starts to growl. Once you eat something, you become full. So when you're full, you typically listen to your body and you'll say, okay, I think I've had enough to eat. I'm going to stop eating. So food inhibits the feeling of hunger. Food stops the need to eat. So what do you think? Is this one a negative feedback or a positive feedback mechanism? This one is negative feedback. The goal here is to stop or cancel hunger, and we do that by eating. So things to look for: stopping the hunger, inhibiting the feeling of needing to eat, and food, of course, is going to do that for us. Let's talk about another example: bowel movements. When we feel pressure in the rectum, we find a bathroom, we push the feces out, and as long as we feel a pressure in our rectum, we're going to push to have a bowel movement. So the pressure enhances the urge to push. There's a key word here for you: enhances. So what kind of feedback mechanism helps us with bowel movements? This is another case of a positive feedback mechanism. Let's talk about the last example: blood pressure. So blood pressure is maintained within a narrow range. Let's say that a person's systolic over diastolic pressure is 110 millimeters mercury over 65 millimeters mercury. If that blood pressure suddenly increases, the brain is alerted, the brain turns on mechanisms to lower or inhibit or stop whatever is causing that increase in blood pressure. So the maintenance of blood pressure is what type of feedback mechanism? This is a negative feedback mechanism. I hope these examples help you get an understanding of how these two mechanisms operate differently, but the end goal is the same. It's to achieve homeostasis or to restore that balance within the body. Well, thanks for watching my video. If you have questions, please leave them in the comments. If you like this video, please follow my channel.